Good morning, everyone. My name is Arthur Slutsky. I'm Vice President of Research at St. Michael's Hospital and the new network that we're part of, which includes St. Joseph's Hospital and Providence Healthcare. I'd like to welcome you all to the Li Ka-shing Knowledge Institute, home to St. Michael's Research Enterprise and Education Center. Today is National Child Day, certainly a very fitting day for this event that we're having today. While many of you think that St. Michael's Hospital only as a leading research hospital for adults, we also treat children and babies as well. Every year, thousands of babies are born at the hospital. From our health team to our labor and delivery unit to our pediatric clinic, many of our researchers and clinicians dedicate their careers to improving the health of our smallest patients. That's why, on behalf of St. Michael's Hospital, I'm pleased to welcome Bill Blair to St. Mike's. Back home for you, I think. Is that correct? For this announcement. Bill Blair is Parliamentary Secretary to the Minister of Justice and Attorney General of Canada and to the Minister of Health Parliamentary Secretary. Secretary Blair.
Thank you very much, Dr. Slutsky, for the very kind introduction, and good morning, everyone. And it's a great pleasure to be here today. As you've been told, today is National Child Day, a day in which we commemorate the adoption of the UN Declaration on the Rights of the Child, and it's particularly appropriate that we should come together today on this day. It's also a great pleasure for me to return to St. Michael's Hospital. This is my old neighborhood, and frankly, this is my hospital. And St. Mike's is an institution that does a great deal to support children, as you know, and families right here in Toronto. It's one of the most renowned and respected of community hospitals anywhere in the country. National Child Care Day is a time for us to renew our commitment to treating children with dignity and respect, to making sure that they have a voice and are protected from harm, and that each of them has the opportunity to realize their full potential. It's also about ensuring that children are at the center of conversations about health and health care. In Canada and in countries throughout the world, we are seeing a rise in chronic diseases such as diabetes and heart disease. And research evidence shows that the origins of these diseases are often found in pregnancy and in the early life of a child. However, research has also shown us that improving the health of children results in improved health outcomes later in life. In other words, making sure that our children are healthy isn't simply the right thing to do. It will also help ensure that those children turn into healthy adults who can go on to live long and productive lives. The Government of Canada is committed to promoting early childhood health, and I am very pleased today to have the opportunity to come before you and announce that we are investing more than $33 million in a major research initiative aimed at preventing chronic diseases by investigating the genetic and environmental factors that contribute to the development of these diseases at the earliest stages of life. In addition, we are announcing $7.8 million is to be provided through a partnership with national research agencies in India, China, and South Africa. Supported by the Canadian Institutes of Health Research, this research is being conducted under the Healthy Life Trajectories initiative, which includes 4 linked projects and a coordinated secretariat based at the World Health Organization. The researchers will be studying families in Canada, India, South Africa, and China, and Canadian researchers will be included on all of the international research teams. Together, they will seek to identify the factors responsible for the development or prevention of chronic diseases from preconception to pregnancy to early life. They will also study the effectiveness of various chronic disease prevention programs so that we can be sure that our policies are rooted in the best evidence. This type of research into prevention rather than merely treatment is also exciting for the promise it holds for helping put us on a path towards a more sustainable healthcare system. I'm very pleased to note that this initiative will soon include an Indigenous health component, which will focus on addressing diabetes, obesity, and mental wellness among First Nations, Inuit, and Métis people here in Canada. This future funding opportunity will assist communities as they work together to establish the expertise needed to support Indigenous-driven research. And we will be working with Indigenous communities throughout this initiative to determine how best to serve their needs. In a few moments, we will hear from Dr. Cindy Lee Dennis of St. Michael's Hospital, who is leading one of the research teams that I spoke of. I would like to take this opportunity to congratulate and thank Dr. Dennis and her team for the dedication to improving the health of our children. Thank you for your efforts. And thanks to your efforts, we will gather the evidence needed to help children get a healthy start to life, to help prevent them from developing chronic diseases throughout their lives, The foundation of lifelong health is laid down in pregnancy and the earliest days of life. And as we celebrate National Child Day, I'd like to encourage all parents to take special care of those most precious moments of life. By promoting healthy living from the beginning, we can put our children on the path to a healthy and productive future. Ladies and gentlemen, thank you. It's an honor to be with you today. And I want to offer a very sincere thanks to all of the professionals who will lead this research and for the difference they will make in the lives of our children. Thank you very much.
Thank you very much, Parliamentary Secretary Blair, and welcome home. This is certainly an incredible investment in Canada's children and families and the world's children and families, in fact. I'd now like to call on Dr. Shu Li to tell us more about the initiative. Dr. Li is Scientific Director of the Institute of Human Development, Child and Youth Health at the Canadian Institute of Health Research. Shu.
Well, thank you, Arthur, for the kind introduction, and to St. Michael's Hospital for hosting today's event. Mr. Blair, we are very grateful to have you here to officially launch the Healthy Life Trajectories initiative, and we certainly appreciate your support and that of our government. It is fitting that we are launching this initiative on National Child Day, because healthy is about giving children in Canada and globally the best start in life, and in preventing chronic disease later on in life. This initiative hopes to achieve this goal by informing the development of national and international policies and programs. It's an ambitious goal. As the Minister noted, chronic diseases occur in later life, but actually they start earlier in life. Now, if you think about it, it's just intuitive. Things don't just start happening when you're 50 or 60. All these things start really early in life. And if you really want to deal with them, you have to deal with them early in life in order to be able to achieve those goals later in life. Now, we know that these chronic diseases place a huge burden on individuals and families. And so this is a really important initiative because, as Mr. Blair pointed out earlier, chronic diseases are a huge problem and an increasing problem around the world. And so we are addressing today through science. And it lies in the evidence that we are providing that we can deal with these problems early in life. Now, this concept is known as DOHAD, or Developmental Origins of Health and Disease. And this is the concept upon which Healthy is based. And therefore, there are a number of components that we have mobilized in this initiative. And they are led by a number of different researchers that you'll meet later on. Dr. Cindy Lee Dennis from St. Michael's, who's leading the Canadian cohort. Dr. Stephen Matthews and Prakash Shah, who are leading the Indian cohort. Dr. Stephen Lai from Mount Sinai Hospital is part of the South African cohort, and Dr. William Fraser, who is part of the Canadian Chinese cohort. So, as you can see, this is a global initiative, and the research teams will develop and test not just prevention and look into the risk factors, but also, more importantly, they will test interventions. This is the first of its kind in the world where we're actually looking at interventions to see how we can actually change the health and life trajectories of these individuals later on in life. Now, these international cohorts are funded in partnership with the agencies of each of these countries. And therefore, I would like to acknowledge and thank our partners, the South African Medical Research Council, the Natural Sciences Foundation of China, and the Department of Biotechnology in India, and also the World Health Organization for their commitment to the success of this initiative. Now, in addition to the cohorts, there are other components that CIHR is funding, including a research platform known as REACH that will facilitate the sharing and use of existing Canadian assets and information, including data and tissue samples from all cohorts that can be used in this effort. Finally, I want to thank and congratulate all the researchers who are participating in the various parts of this initiative. We've created an ambitious plan and a program that is groundbreaking. In fact, it's the largest program of its kind in the world. And we know that working together, we will produce far-reaching benefits for global and Canadian populations to reduce healthcare costs and to improve health for all in the world. Thank you.
Thank you very much, Dr. Lee. I'd now like to introduce you to two researchers who will be the Canadian leads in two of the Health Life Trajectory Initiative countries. Dr. Cindy Lee Dennis has a PhD in nursing and is the Women's Health Research Chair at St. Michael's Hospital and the University of Toronto. She's a scientist with the Li Ka-shing Knowledge Institute, as well as professor in the University of Toronto's Lawrence Bloomberg Faculty of Nursing. Dr. Dennis will lead the Canadian arm of the Healthy Trajectory Initiative. Dr. William Fraser of the University of Sherbrooke is the Canada Research Chair in Maternal and Fetal Health. He's an obstetrician trained in clinical epidemiology and will be the Canadian lead of the Healthy Life Trajectory Initiative in China. Cindy Lee.
Thank you, Dr. Slutsky, for that introduction. Parliamentary Secretary Blair, colleagues, and friends. As Dr. Lee mentioned, Healthy offers a unique opportunity to advance research on the effect of early life exposures on child's health and well-being globally. At this time, I would like to take a moment to expand on the Canadian contribution to this international initiative. In a recent UNICEF report on child well-being, Canada ranked 17th out of 29 high-income countries. Of particular concern is nearly 1 in 3 Canadian children are overweight or obese, placing them at cardiovascular risk for cardiovascular disease, and for diabetes. About 1 in 4 Canadian children are not developmentally ready for school, and 1 in 5 children has a mental health problem in Canada. This has enormous consequences on the future of Canadian children and in our society. However, there is good news. Early interventions can alter this negative trajectory. Healthy Canada will develop a new cohort that will allow us to follow families longitudinally for years. We will also evaluate a package of early interventions and its effect on child obesity, cardiometabolic health, and a broad set of indicators of child development. The project will use existing structures in public health and primary care to recruit over 5,000 women and their partners and their children from Alberta, Ontario, and Quebec. And we will evaluate the impact of the interventions that will be delivered from preconception all the way through to early childhood. These time-sensitive interventions will focus on health behaviors related to nutrition, breastfeeding, physical activity, sedentary behaviors, and sleep. We will also be promoting a safe and nurturing environment for the children and the whole family. Importantly, all interventions will be delivered through the use of technology, from telephone-based collaborative care provided by public health nurses all the way to e-health interventions that target identified risk factors. Our innovative design will allow us to measure the cumulative impact of the interventions when they are initiated during the preconception phase and then altered to respond to the specific needs of the family during pregnancy, infancy, and early childhood. The project will also investigate the role of fathers and their impact on child health, which has frequently been ignored in previous studies. It is important to acknowledge that fathers matter too. Healthy Canada comprises of a pan-Canadian team of 48 established researchers from 21 institutions across 6 provinces, and we have the proven expertise to successfully undertake this project. Healthy Canada has a strong focus on public health and will align with the national and provincial plans to enhance primary health care. We will contribute to healthy policy around early child development. Our team will have the right conditions in place to enable the scalability of these interventions, both provincially and at a national level, if proven to be effective. I'd like to thank the Canadian Institutes of Health Research for their investment in this initiative, with a particular focus on Dr. Lee. I'm proud to be part of this research that is focused on building a healthy and productive future for our children. Thank you.
Parliamentary Secretary Blair, Dr. Lee, and colleagues and guests. I'm very proud to represent the University of Sherbrooke at this press conference today. Our collaboration with China is based on a long-standing scientific collaboration and friendship that goes back over 10 years. The colleagues in China are at the top of their discipline in their country, but also leaders internationally. We're working with researchers from Shanghai Jiaotong University, which is a top institution in China, and also Fudan University, which is the top public health organization in China. The International Peace Hospital is the leading maternity hospital in Shanghai, and the president of the hospital has just been named as a member of the Chinese Academy of Sciences, which is the highest honor, actually, that can be achieved in science in China. So it's been really exciting developing a collaborative team across our two countries. We have representatives from the University of Sherbrooke, from Laval University, from McGill University, from Queen's and the University of Alberta, and we're building on Canadian expertise. The Canadian Obesity Network is really a world leader in the area of obesity prevention and management, and we are using a lot of ideas that were developed in Canada and that have been practical applications and strategies to prevent obesity in families. So we're taking Canadian technologies and knowledge to China, but we're not just exporting it. We're actually testing the cultural relevance of these approaches in China. We're doing qualitative studies just now to test with women and with managers, with healthcare managers, policymakers, and decision makers to ensure that the approaches that were developed here are applicable there. And surprisingly, women across the world, families across the world are faced with the same challenges: getting safe food for the family, high quality food for the children, food that can be prepared in a context of rapid changes in the family structure, economic changes. So these are challenges that women and families face across the world. Our study, I believe, is going to have an impact. Hopefully, we'll be able to demonstrate a benefit of an intervention. The study will be conducted in 32 maternal child health districts in the city of Shanghai. And if the study demonstrates the benefit, then we expect that there will be a rapid uptake in terms of policy. We're conducting the study also in a city, as you know, where there's been a dramatic economic change over the last 20 years. So it's, in a sense, a perfect storm in terms of the changes in society that have impacted on child growth and development. And in fact, the obesity rate in the Shanghai area has more than doubled over the last 10 years. We're focusing at two levels. One, on behavior change. So yes, it's placing a certain burden on the families, on the mothers in particular, to make healthy decisions. And our goal is to support them in the decisions that they make and to focus on their own empowerment in terms of navigating through the system so that they will be able to provide the best possible environment for their child and for their family. But we're also focusing at the community level so that the communities themselves will become involved and empowered in the project. The maternal child health centers in Shanghai are very active. They see every child regularly throughout their development up until school age. So it provides a remarkable opportunity to offer and to partner with the community level public health intervention program and to create a sustainable long-term benefit. So we're building on existing strength and we're using Canadian expertise, and we believe that our study has the potential to really make a change in the environment. So thank you very much to CIHR for the support for this program. We look forward to giving you good news in terms of its impact over the coming years. Thank you.
Thank you very much, Drs. Dennis and Fraser. I'd also like to thank the CHR for their vision for such long-term studies. You know, many of the studies that are supported by granting agencies are 1 or 2 or 3 years. This is a 10-plus year project, and that's important for this kind of study. So thank you to CHR. These studies, as I said, are going to be long-term, impactful, and generalizable. And they're going to put Canada on the map for this kind of work. Even though we're relatively small from a population perspective, the impact of these studies is really world-class. So thank you to CHR, thank you to the government, thank you all. I'd like you to ask Drs. Dennis and Fraser to come up, and Dr. Lee and the Parliamentary Secretary to return to the stage for a group photo. Could you come up first? And yeah, I think we should have. Where's a good place to? Thank you. Thank you, Parliamentary Secretary Blair and Dr. Lee, for this multi-million-dollar investment in Canadian research. The Parliamentary Secretary, Drs. Lee, Dennis, and Fraser will be available for media interviews immediately after this announcement. And media will also be available to join the speakers and researchers for a visit to St. Michael's Labour and Delivery Unit. Thank you for joining us at St. Michael's today for this exciting announcement, and happy National Child Day. Thank you.